As Steve was sharing about my experience, one of my favorite things to do in the year is to come and be with Richmont students. As Steve was laying out, in my education, I went to Bethel up in Minnesota, and then I went to Trinity and got my master's in counseling in Illinois, and then I went to Wheaton and got my doctorate, and then I kind of jokingly say, like, I made sure I hit all these Christian schools to make sure I didn't miss anything, you know. So here I am at Richmont, and I'm still receiving a lot. I want to open this evening with a story, and hopefully it connects to maybe your experience, but also where I want to go this evening. When I was a child, I had the experience of going fishing. I don't know if you all had that same experience that I did, but you would go, sit in a boat, put a worm on the hook, and then wait for a long time, and nothing would happen. And then did this for years, and when people would ask, do you want to go fishing? I'd be like, honestly, no. Not looking forward to fishing. Then I had the opportunity to go fly fishing in Montana, and I had a guide. I had someone with me who would untangle all my knots and fix all the flies and would coach me on how to cast these long, sophisticated casts. And so, not knowing anything, I had a low self-esteem in the fishing world. I would start to cast, and then finally I started to get some confidence, and I started to cast a little further and a little further, and there was something in me that thought, if I cast longer and stronger, I'm a better, more sophisticated fly fisherman. So the guide came up next to me. His name was Merritt. He had the whole look going of a Montana guy. Cowboy hat. He had the dip in the corner of his mouth, and he would just kind of sit there and look at you, but then he'd tell you to do something. So he said, "Wow, John, that was a beautiful cast." And so my self-esteem is picking up a bit, and I went a little bit further. And he's like, "Wow, John, I got to tell you, that's a beautiful cast. Like, you're really coming along here." So I'm, getting all excited about it. And I, wind up and do this long cast, probably to the back, not quite to the farthest table, but maybe second to the last table. And he goes, "John, as your guy, I got to tell you, that was a beautiful cast. But can I tell you something?" I'm like, "Sure." "Hey, the fish, they're 2 feet in front of you. You've been overcasting them the whole time." And the reason why I share that story is, how often do we as clinicians in our work get enamored with the long cast when really some of the things we need to get back to are right in front of us? With all the evidence-based treatments, with all the sophisticated models, sometimes it's helpful to get back to the thing that's right in front of us. And normally it's us. It's our own feet in the water. And tonight I want to really lay out 2 models that it's really to stir your thinking, because it's helped me in working in trauma and in working in highly contentious environments. I think there is a tidal wave of mental health coming our way. It's happening now, and it's going, once we all know this as clinicians, once the acute event and we survive something happens, we then start to feel. And I'm actually more concerned about the mental health crisis once things are better and we feel again. And what do? And by the way, when we feel, we're going to be coming to your offices looking for tools and resources. So in some regards, tonight is an encouragement to think about, what is the stance that might be protective and at the same time evidence-based in engagement? What if there was an evidence-based engagement strategy that actually could be protective for us? And then what are some things that we can do? There's a lot of discussion that we have. We've all been to conferences before, and we've heard about what are things we can do when we're taking a break from the work. But what are the self-protective practices in the work? Like when you're in the office, when you're engaging kids, families, and adults. So that's the outcome I hope to achieve as a result of our time tonight is, number 1, what is the stance? And I'm going to borrow from motivational interviewing. How many of you have had any training in motivational interviewing? Okay, so some of you have had it. I'll tell you, I've been trained in it, but it's been one of the most helpful models in enhancing my engagement strategy with kids, youth, adults. And so I'm going to start there, and then we're going to have some dinner, and then we'll go into looking at kind of an engagement strategy where we can be protective in the adversity. I want to start with like this question: why is change so hard? I'm sure many of you have been asked that question in your clinical work. It is hard, and a couple things that we know about what are variables that contribute or affect change. This is the Prochaska and De Clemente's stages of change. Not everyone is in the same place of change. You know, some people it's not even on their radar, pre-contemplation. Some people, they're just starting to think about change, contemplation. Some people are starting to prepare for the change. They're making some steps. And then some people are already in the action phase. And some people have made the change and they're just trying to maintain it. And we know from our work that people move in these changes and stages. They relapse, they go backward, they go forward. And so change is hard because not everyone's in the same place when they're coming to us with change. So understanding where are they at in the change process is an important piece. There are also kind of external variables that either lead people towards change or prohibit them from seeking change. This is, if you think about, this is going to be called the SCARF model. The SCARF model looks at what are the external conditions that either lead me toward like change or reward, or paralyze me in threat or maybe being ambiguous about change. And these are the variables: status, certainty, autonomy, relatedness, and fairness. We're going to break those down just a little bit. So these are all external engagement factors that are going to affect whether someone's going to approach change or it's going to stifle change. What about status? When someone comes to your office, do they perceive that they have value, that you see them with value? Or are you a technician who's going to critique and diagnose and have hierarchy? Is the status even? That's going to move more towards reward or change, or is it hierarchical? Critique. This can, by the way, these variables are true whether they're in our clinical spaces or you're leading an organization. As a leader, you want to think about, if I want people to change and move and grow, if they're feeling critiqued, judged, it's going to be hard for them to think about change and growth. What about certainty? We're experiencing this right now with the pandemic. As they peer into the future, is there a clear sense and assurance and affirmation? That's going to lead people towards change. Clear assurance and affirmation. When they come to you and you're able to affirm them, you're really taking your mental health serious. There's some things that we can do to treat anxiety. There is a way to navigate your marital conflict. They can see some certainty ahead of them. It's clear. I mean, think about what this pandemic has done. Look at the bottom there. Unclear and uncertain change ahead. Just spikes anxiety. Doesn't lead to openness and change. So certainty. If you're in this room and you're a leader of an organization, do your staff kind of look ahead and they're like, I feel clear and certain about my roles and responsibilities? What about autonomy? You're going to see autonomy show up a lot. I have choice versus controlled. In treatment, is there a partnership with you where they feel like, there's a lot of ways we could go about this. I'm curious, what are your thoughts? What would you like to do? Autonomy. Controlled would be, the best practices show that you should do this. Why aren't you? Or, you need to do this. You will do this as part of your job description. So autonomy, people having a sense of autonomy is going to contribute. When they sense in the environment, do I have autonomy? It's either going to lead towards change or towards stifling change. What about relatedness? Change is at its best when we are together, like we are tonight. I look around and I feel connected to the Richmont community, and we can make kind of a difference in mental health together. There's a sense of connection and relatedness versus isolation and exclusion. When people feel isolated, they're surviving. But when we feel like we're approaching the social environment and there's a sense of relatedness, we're more apt to be open to change and reward. And then fairness is the final one for the kind of the social conditions. I'm being treated fair, or I'm being treated unfair. There's a sense of fairness. People don't want, if the system is rigged and it's not fair, people don't put forth effort. But when they feel that it's fair and equitable, they're more apt to seek change. So this is the external environment that we need to be thinking about, SCARF. But what does the research show about internal? So this is taken from self-determination theory by Ryan and DC. And they found that if you want to look at what are the 3 things you need to be self-motivated to change, you have to have these 3 things. You have to have autonomy. There it is again. So you have to have an external sense of autonomy and an internal sense of autonomy. That's going to be very important. The second thing is competency. Do we feel like I can do it? If I embark on that exercise plan, is the plan realistic and I'm competent enough? I have the skills and the abilities enough to do it, or I'm given a task that's really challenging. I have the autonomy, but also the competency, the resources within me and around me to move forward to that change. I'm more likely to move forward and have motivation. And then finally, relatedness, a sense of connection. Again, that was actually one of the variables in the external environment. It's also something we need to feel internally about our experience. And so a lot of our kids and our families and adults stand at this crossroad. They're making choices. They're thinking that what's hard to see there right in the middle is that it's got that SCARF status. They're looking into their horizon, their future with status, certainty, autonomy, relatedness, and fairness. And they're thinking, is it a threat? They're divided. Now, I don't know if all those conditions are really safe. I don't know, it's hopeless. In motivational interviewing, we call that sustained talk. It's sustaining, like, I don't think I should really do anything because it feels like a dangerous thing. Or maybe reward on the left, the reward of change, the prospect of change. This internal voice is, I can make these changes, I am capable. And we call that change talk. And so the research shows in motivation interviewing, when we can get people into change talk, that change is more likely to happen, right? And what's really important to remember is that this tension between these 2 forces is something that is one of the biggest emotions all of us have to tackle in life or in our clinical work, and that is ambivalence. Whew. Boy, that's a tough one. You got to hold 2 things in tension. Part of me wants to do this math. Remember when you were going through your program at Richmont? You were approaching it, you're like, part of me wants to do this, and then you look at all the required courses, and you're like, yeah, part of me doesn't want to do all that. Part of me wants this new internship challenge. No way, I feel totally inadequate. That's the ambivalent dance that we're talking about. Most people are coming to treatment ambivalent. I want to see you, but I don't know if I can trust you. I want to make this move in my career, but I'm afraid. By the way, going into hard places is not necessarily, ambivalence is really not a bad thing. It's actually kind of an invitation. I like to say when you're coming up against ambivalence, you're getting closer to change, actually. So embrace it. I love this quote by Joseph Campbell. "The cave you fear to enter holds the treasure you seek." Talk about ambivalence. I want to go in that cave. That's scary, but it holds the treasure that I seek. Actually, in Joseph Campbell's work, he talks about, in The Power of Myth, this may be hard to see. Well, actually, it looks pretty clear up there. Look at he looked at every myth and kind of essentially looked at the cadence, the structure of every story. And look at how interesting this path is. Everyday life, call to the journey. Notice, now we're going to hit what? Ambivalence, refusal, resistance to begin the journey. And then, of course, the hero works through that and then enters into these other parts of the process. All of our clients, all of us as developing professionals are going through this journey. Every one of us can think of times we wanted to refuse that journey ahead of us. So resistance is part of the process. It's not a bad thing. In fact, here's Stephen Pressfield, the author of The War of Art. I love this quote: "The more important a call or action to our soul's evolution, the more resistance we will feel toward pursuing it." There's another quote from Pressfield. "Like a magnetized needle floating on the surface of oil, resistance will unfailingly point to true north." Meaning that calling or action it most wants to stop us from doing. We can use this, we can use it as a compass. We can navigate the resistance, letting it guide us to that calling or action that we must follow before all others. Again, Stephen Pressfield from The War of Art. Now, so we have clients at these crossroads struggling with ambivalence, and they're assessing in their environment the social variables, and they've got the internal variables, self-determination variables of autonomy, competence, and relatedness that they're grappling with. And then here's us, helpers. You're here because, and probably you came into this profession because you wanted to reach out and help someone. You've developed this, or you had this muscle of wanting to help or fix someone. Now I want you to hear this is one of the developers of motivational interviewing, Stephen Rolnick, says. There's this muscle that we develop, he calls it the writing reflex. And here's his description of it. Whoops.
I'd like to address this topic of the writing reflex, which is a term we developed to describe something we noticed outside of motivational interviewing in everyday life. Let's take the example of a mother who's trying to teach a kid to do a puzzle. Using the writing reflex, that mother will simply say, no, don't do this, do that. A problem is seen and the problem is solved for someone else automatically. The problem is that inhibits the learning of the child to solve the problem for themselves. As therapists and counselors, we can fall into precisely the same trap that mother did with her good intentions of trying to help the kid solve the puzzle. So faced with a client with multiple problems, given the reasons why we went into the helping professions in the first place, it's just a short step from solving the problem for the person. And that has two effects, which I'm sure you have noticed in your everyday practice. One is, if you like, it taints the relationship between the two of you. It doesn't make for a nice, constructive conversation, and it places a weight on you to solve problems for people, and they tend to shut down. The second can be observed in the behavior of your clients, which is that it doesn't lead to good outcomes. And there's reasonably solid research evidence to support that. This observation about the writing reflex provides one of the clear rationales for motivational interviewing. I'll add just one caveat here. That helpful spirit of yours, the use of that can be channeled into giving someone advice. And skillful advice giving is not the same thing as succumbing to the automatic unconscious use of the writing reflex. and how you give advice skillfully so that it's congruent with motivational interviewing. That's going to be an interesting topic, but it's not the same thing as the writing reflex.
We'll come back to that, skillful advice giving. This is a quote taken from John Bowlby, the famous attachment theorist. While some traditional therapists might be described as adopting the stance, I know, I'll tell you, the stance I advocate is the one of, you know, you tell me. One of the things that motivational interviewing does is it makes us grapple with this metaphor. If there's been any picture that's been the most helpful, I think in pictures and even in my work, this one has rescued me. It's also been a metaphor or a visual for good office discussion about giving each other feedback, by the way. And essentially, and just to kind of move out of my camera view for a minute, I want you to envision that you have two chairs. You know, you've got the resistance chair here, and you've got the change chair. And as I've been kind of laying out, as well as what you heard Stephen Rolnick share, by the way, this is a good thing. This is not a bad thing. We are, out of our compassion, out of our empathy, we got into this field to help people. But so what's the chair we're drawn to? We want to sit in this chair, the helping chair. But when I'm sitting in this chair, what's the only chair left open?
Resistance.
The resistance chair. How many, now, believe me, tonight's talk isn't going to be about how we can be resistant therapists. I promise you, that's not where we're going. That's a pretty startling visual or idea. It's very different than what we've maybe thought about before. I know it was for me. But the goal isn't to get into the resistance chair. What we're going to talk about is the goal of treatment is for us to get out of this chair. If I'm out of this chair, who can be sitting in it? The client. Yeah. And actually, we're going to go back to ambivalence and even all those variables like the SCARF model and the social determination theory. Really, our role is to stand behind these two chairs and just describe both of them and have a conversational style that isn't judgmental, that is one that has an invitation, and accepts them that if they want to sit in this chair. How many of you work with kids and parents? Okay, I'm gonna put 100% bet you've all had experienced this. You sat in the change chair, they're like, I just want to know how to parent them or what I should do. And you, out of your writing reflex, sat in this chair, and you said, well, this is what we know about good parenting, so I'd like you to do this. And their first response is, well, we've already tried that, our last therapist told us to do that, done that, done it. It's almost like you lined up all the best practices and they knocked them all down. And now what? So, oftentimes that's not a function of your work was great, your suggestions are right. It's just sometimes when we're sitting strongly, firmly in the change chair, it's almost like they get into this chair. So, how has this been valuable for me? Again, first of all, number one, you will get in the change chair. It will happen. Do you notice when you're getting into it? The second thing is, when you notice it, do you know how to get out of it? And then come back to naming both. Yeah, okay, you're thinking about whether you want to stay in this marriage. Like, you're not afraid to speak to all the resistances of that. Yeah, you don't know if you can do this anymore. You don't know if the change, it might be too much change to occur. It's hurt too much. And you also came here because you thought maybe something would happen. Something different. So the intervention is about naming and exposing the both parts of it, not sitting in one or the other. My colleagues have been like, whoa, John, you were really changed here on that one. I was joking about therapists sitting in the resistance chair, but have you ever caught yourself in that chair? Hey, if you're going to show up 20 minutes late, I don't know how much I have to give you tonight. Come on, we've all done it. We felt our own resistance, our own pushback. So the goal, this is a really helpful image. And where it's helped me the most is even when with my good intentions, and I know what's right, and I know what will work, to be careful not to get in this chair. How many of you saw this show? This probably, I feel like it was about 12 or 15 years ago now. The Jamie Oliver Food Revolution. Anybody? Okay, so I saw one, I got one hand over here, a couple, yeah. So Jamie Oliver is a chef. And he did a show where he wanted to have, he identified a city in the United States that had the highest level of mortality and obesity. And essentially he said it's the most unhealthy place in the United States. And he thought it would be a great idea to go and bring his best to help them. So I want you to watch what Jamie Oliver does here and whether he gets good outcomes.
To work in Huntingdon is an absolute honour. It's such a beautiful place. I mean, look at the view. I know I can make a difference to this area. I know. And part of me is really excited and part of me is really scared. But I want this area of West Virginia to be proud that the food revolution started here. Huntingdon is a big town and I'm one man, so to kind of get all the locals to know why I'm here, what I'm going to do and how I'm going to do it, I've got to get out there. So first off, I'm going to go to the biggest local radio station in town. This is a really big deal for me to sort of kick things off here.
Country favorites in fun, W3.7 The Dog. And folks, Jamie Oliver is in town. He's on some kind of a mission, and we just don't know exactly what this mission is, so he's here to explain it to us.
How you doing, man?
First off, let's just get up and say this. What are you here for?
I'm here to start a revolution, a food revolution in Huntingdon, West Virginia, the biggest food revolution that this country's ever seen. Last year, the results came out that this town was the most unhealthy town in America.
Why would you say that we are? Because there's other cities that have the same problems that we have.
Because this is a government statistic based on death, based on disease.
So you're saying that we die quicker than anything?
Yes, this area is the most unhealthy in America.
Right, but we don't want to sit around and eat lettuce all day.
Yeah, but I'm not going to cook you a lettuce.
Well, I'm just saying, you come to town and you say we're going to change our menus and all that. And I just don't think that you should come in here and tell us what to do. I mean, who made you the king? When you leave here in 2 or 3 months, things are going to be turned around.
If everyone in America was like you would get nothing done. You can't be, oh, that won't work, you never do that, oh, you're going to be 3 months, what are you going to do?
So what you're saying is when you leave here, everybody's going to be eating healthy and everybody's going to lose 50, 60 pounds.
I would never ever say that. I'm talking about a seed of change. I'm talking about not just at home, I'm talking about schools, I'm talking about fast food industry and the restaurant industry. I mean, I'm opening a shop in town. It's a place where anyone can come in, and if they want to learn how to make a few dishes that don't cost the earth, we'll have people teaching them there. I suggest you come along and I'll teach you how to make a couple of things which don't have lettuce in them.
Well, we'll see. We'll see how things turn out. Jamie Oliver has been our guest this morning, folks. I really take issue with a guy coming into town and telling us how we should conduct our lives.
That didn't quite go the way I thought it was going to go. Bastards like that in England.
I don't think Jamie's got anything that can change this town. He can try all he wants. I don't think he's got it.
When I drag that grumpy old git down to a school or the cooking centre and he sees people in need getting filled up with the tools for them to look after themselves, he's going to shut up.
He didn't get the outcome he was hoping for, did he? What you're seeing here, clearly he was sitting in the change chair, right? And so then it just opened up for the radio show jockey to just sit in the resistance chair. We call this the old muscle. This is when we're operating out of the old muscle. It's a hierarchical, remember in that scarf model, status? When there's a perceived sense of, we used to, in a kind of a modern world, we really privileged hierarchy. A physician came in, examined you, had a diagnosis, prescribed medications. Treatment was really about compliance. You almost feel that way here, like, I've identified the data, I have a solution, I'm here for you to follow it. Food revolution. So a hierarchy, maybe a therapist takes that same stance. They've been trained with all this information and expertise. Our job is, I jokingly say to my students, this is at the end of their training. A lot of our training is like the Wizard of Oz. You came to Vanderbilt kind of going down the yellow brick road looking for the wizard. Like, where's the wizard? And, at the end of the internship, I say, there is no wizard, right? It's just a guy who's balding and doesn't know everything. In fact, the Dunning-Kruger, the more you get into this field and the further, you kind of go from, like, I know everything to, like, I know nothing. There's a level of humility, and then you start to go, because I know nothing, I'm starting to really appreciate these kind of things in the work. It's called the Dunning-Kruger effect. And so, but that's not what's happening with the old muscle. You have the authority to identify dysfunction, you give advice, and you're kind of confronting resistance. Why aren't you working with what I'm recommending? And parenting can be the same way. In this old muscle, you're prescribing behavior, confronting resistance, enticing and warning, maybe emotional blackmail, consequences, restoring your authority. How do we get into that old muscle? This is a metaphor that I've used in my child trauma intervention class, and I apply it to a lot of different pieces, but one of the ways that we get there, I use this, it's called it's the Irish Road information processing model. And what happens is you're making observations. You're doing this with me right now. You're making observations with your senses. You hear my voice, you feel the temperature of the room, you're seeing the input, and you're making interpretations about what I'm saying. Is John saying anything that can have relevance to my work or to what you all are doing at Richmont? And then you're processing, evaluating options, and then you're planning, and then of course you act deliberately. This is under mild to moderate stressful conditions. Of course, if I drop a snake in this, if I dropped a snake, you would have hoped this would have been a pandemic Zoom reunion. But if I dropped a snake in this room tonight, you're going to respond to this very differently. You're going to take a shortcut. You're going to make the same observation with making the interpretation and really basically cutting across the road and reacting. You don't jump on the table, run out of the room, attack me for bringing snakes to a reunion. But what's interesting about this model is not just what you do, it's what you drop. Do you notice what you drop? Processing, evaluating options, and planning. And in fact, for kids with chronic traumatic stress and families that are involved in our child welfare system, they live on the shortcut. I've parented on the shortcut. I've got 4 kids. My wife would tell you, John, you responded to me on the shortcut. You're not processing, evaluating options, and planning. Sometimes in your clinical work, when you're really exhausted, irritable, tired, frustrated, it can feel like this. And you're not at your best for processing, evaluating options, and planning. So I like to think of this as a metaphor for not just what happens inside us, but what's happening in systems. Child welfare, for example, they're living on the shortcut right now. I don't know how it is here in Georgia, but Tennessee's child welfare, we're in crisis right now. The level of vacancies in case management. I just did a talk for our Nashville businesses, and I use this I think the aviation and the restaurant businesses, people are leaving restaurants like crazy because of the level of anger and disrespect. People are taking the shortcut over their food orders right now. We're in a high level of agitation. And so what do? When we react, we do these types of things. We get into our old muscle. We say something mean, we lecture, power struggles, lack of full understanding. We have a loss of compassion. We feel hopeless or helpless. We can feel confused or irritated. Oftentimes we try to restore control, not autonomy. By the way, if you do this, you're totally normal. our biological systems are actually designed for this to happen pretty regularly, because your threat systems are always trying to do something to maintain survival. So this is a normal thing. I mean, if you're sitting there going, oh my gosh, you're totally normal. It's about just knowing that what gets dropped is, you can actually think about therapy when we're standing in the right place and we're really kind of monitoring our own reactions. Therapy really is about engaging in a relationship where we can become so safe with our clients and families that we get rid of this road closed and have a consistent, predictable, safe place where we can, as a family, child, or parent, couple, process the hurts, the experiences, evaluate options in terms of coping, and make plans deliberately so that we're no longer stuck in a reactive mode, we're acting deliberately. That's really what a lot of our work is about. So just remember, if you find yourself getting into your old muscle of hierarchy and kind of authority, it might be coming from taking the shortcut. Now there's traps on that shortcut that are very similar to the things that I talked about. There's the question and answer trap. Have you ever done? I mean, I've done every one of these traps. I do and I've done. This is like, well, have you thought about this? No. Well, did you know that you could do this? I don't want to do that. Like, it's just this, you're playing tennis on kind of the questions, and then they're hitting it back. Well, do you know that that's going to maybe violate your probation? I don't care. Like, okay, well, do you want to talk about anything? No. It's just this back and forth, back and forth. The way we're dealing with the interaction is we get caught in the question and answering trap. Sometimes we get caught in the labeling trap. You see this a lot. How many of you work with schools? You may, so oh, here comes, it's one of those kids. We prematurely label, or maybe even in clinical work, your first impression, instead of staying open to assessment and maybe the relationship a bit, like, I think this might be an emerging borderline, right off the bat. You're closing down on labeling. And so what that does is it biases the rest of the relationship. It doesn't keep you open. And by the way, our clients pick up when we tend to kind of go to labeling, because it can be kind of a form of judgment. Yeah?
I'm finding that a lot of, especially young people, are looking things up to identify themselves.
Sure.
And labeling themselves, and then it's harder to backtrack them out of that label. And I've had to look up stuff because I'm not.
That's a really good point. Yeah. Yeah. They're coming in with labels.
Yeah.
So identity is really big right now.
Yeah.
Yeah. And so controlling those labels is part of it as well. Yeah. Yeah. Good point. Yeah. Sometimes this is called the premature focus trap. It's when we're really honing in, like once we've labeled, we're prematurely focusing. We probably haven't done our due diligence of listening, deep listening. We kind of are honing in, starting to move on that problem solving when really we need to spend more time in listening. So the confrontation and denial trap. I call this if you remember the movie A Few Good Men, like you can't handle the truth. We just want to confront them. That's very old muscle. What about this one, the chat trap? Because we as clinicians are anxious, or we haven't done the due diligence of listening and drawing out, we get trapped in the chatting, the chat trap, how things are going, and we're not really getting into the work. It's a way of colluding around avoidance sometimes. And then just simply being the expert trap, and kind of being the expert. And sometimes, our clients come with that expectation at times. You're the expert, so you tell me. How many of you, we've experienced that one as well? Yeah. So in motivational interviewing, we talk a lot about developing this new muscle. As a physician, we're respecting autonomy. We're providing patient care that's empathic, and we're explaining and reassuring and offering treatment options. In therapy, we're engaging, but we're also really empowering voice and choice. Assisting and understanding, it's a strengths-based approach. Maybe in parenting, that new muscle is clarifying expectations, teaching skills, coaching, being a coach as a parent. Emphasizing choice and control and supporting change. I was actually, before we were starting, I was talking with one of you all, and I'm drawing a blank on her name right now, but she works in a residential treatment center, and if you ever want to practice your old and new muscle, work in a residential treatment center. It's so hard, it pulls for that old muscle all the time. And there's actually another reason, especially in residential treatment, actually that's what home is for them. Home is about that feeling of power being always in the equation. So when you offer autonomy, you've offered a foreign land. When you've offered competency, you've offered something very different. So that's this new muscle. Here's Bill Miller, one of the co-developers of MI, talking about this different shift, old muscle, new muscle.
Fundamentally, motivational interviewing involves a change in role, a change in how you think about what you're doing. You're not the expert there to fix the person. You don't have to make the person change. The truth is, in fact, that you can't make a person change. You don't have to be the one to come up with all the good ideas. A person with really good ideas is sitting across from you and may have better ideas than you do. It's not like a competitive sport. It's not like wrestling where you try to defeat and pin and outsmart and outwit the person. It's more like dancing together, moving together, adjusting your movements to the other person. Overall, motivational interviewing is not a directive approach. Neither is it just a following approach. Following is listening to the person and kind of going wherever they go. Motivational interviewing is in the middle, between those two. And we describe it as guiding. If you go to another country and you hire a guide, you don't expect the guide just to follow you around. That's not what you're looking for. Neither do you expect the guide to order you when you will arrive, when you will leave, what you want to see, what you will enjoy, what you're going to do. That's not a good guide either. Good guiding involves good listening, as well as using your own expertise. A good guide will find out where you want to go, what you're interested in, what you're hoping for on this journey, and then help you get there using his or her own expertise, enjoyably, safely, efficiently, perhaps. That's the guide's job. Not solely directing, not solely following. There's some of each in it, but it's a blend of those things. This may or may not be the way you've been thinking about your own work, but we invite you to try it out.
Well, let me stop there for a minute. What's your reaction to this? What do you find yourself, it may be affirming you right now, it may be rupturing you a little bit right now, it may be doing a little bit both, but what, can I ask from you all, what this approach of old muscle, new muscle, change chair, resistance chair, what does this have you thinking about? Yeah.
So I actually work in a residential district treatment center too.
Yeah.
But it's not mostly old muscle, it's a community model. And even though we want them to go in a certain direction, there's something about the empowering, especially in a population of people who don't trust in their own judgment.
Yeah.
So I find that when we do that, they're surprised that we would even give them that opportunity often.
Yeah. It's therapeutic just to have something different in that. Yeah. Thank you. How about others?
Think about somebody that I've worked with very recently that has, a ton of trauma, like probably, in the 11 years I've been doing this, maybe she's probably my top And then also, all along, I realized she had OCD personality type. And what I'm thinking of is how, as a therapist, I was trying to observe, who am I? Am I the guide, director, follower?
Yeah.
And with that combination, I often get into a wrestling match with her.
Yeah.
I don't need to.
Yeah. Yeah.
You know, and that it takes a lot of practice,
Yes.
if you will, to remind yourself. I can see myself reminding myself every time I work with this person, don't get into a struggle with her.
Yes.
But the disorders themselves get fed that way,
Yeah.
and so they will ultimately want me to feed them that way.
That's right. That's right. I'm so glad you shared that, because in some regards, that's why I'm talking about this first, is that Rolick and Miller had therapists coming to them saying, has the data come out on this being protective from burnout? Because when I'm not sitting in that change chair, I'm free. It's freeing me up from holding the emotional burden, the emotional obligation, the professional obligation, that I'm responsible for their change. That's a big shift. Yeah.
Yeah, it's just made me evaluate some of the clients that I seem to be stuck with, kind of like what you're saying. Because I'm falling into some of those traps.
Yeah.
But this speaks to who I really want to be as a therapist. And I've been doing it for over 20 years.
Yeah.
But this is why I like the spirit of this, because I've been doing it for so long, and I'm not here close enough for retirement. It's energizing.
It's calling you back.
Yeah.
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 To what you've always wanted to do.
Yeah.
Yeah.
Exactly.
How about others? Yeah.
One piece from an integrated perspective, and one thing that was very transformational for me was the realization that I'm never alone, and that the Holy Spirit is going to guide me as a clinician.
Yeah.
And if I'm working with a believer, that the Holy Spirit is also going to be their guide. And so that further removes the weight. I can still stand behind the two chairs.
Yeah.
And still be relying upon the Holy Spirit,
Yes.
regardless of whether the person is a Christian or not,
Yeah.
to help them to move in the direction that's going to be most
Yeah.
advantageous for them.
It's really helpful, the partnership of the Holy Spirit in keeping us at our station. That's the ultimate wisdom, right? Yeah. Thank you. Any others? Any other reactions? I think for me, it's just always a reminder to reclaim my position, my stance in the therapeutic relationship. Now, in motivational interviewing, one of the things that they talk about is, and this is really important, and speaking to the kind of the spirit, that you can't do motivational interviewing without these four pieces. It doesn't, actually, they found it doesn't work. There's a couple tools that we're going to talk about later, but it doesn't work unless you embody the spirit of motivational interviewing. Just as an interesting side note, Miller, who is one of the developers, lives in New Mexico, and I think he wanted to go into pastoral ministry. He ended up becoming a psychologist. So this is a secular model, but you see it very consistent from some of the theological, kind of perspectives that we have. So here's what here's what Miller and Rolick have found. The first thing is collaboration. If you want to go fast, go alone. If you want to go far, go together. In Proverbs. Collaboration. So your spirit is one of partnership, two companions on a journey, as you heard Miller share, each with expertise. Our approach is supportive rather than persuasive. We're not selling them on this. This is a very important one. MI is done for and with a person, not to and on them. to pull from Star Wars. This MI is not a Jedi mind trick. I've heard people say, you know what, this is a really difficult client. I think I'm going to use MI on them. On them. MI is about this is a stance of who this is just who I am. If you ever hear someone say, I think they're really resistant, I'm going to use MI on them. I'm going to use MI. I actually would go to that person and go, just wait. Just wait. Just settle. It's never done. If anybody does something on you, is that going to be helpful? The minute if I'm going to do it on them, they're going to sense manipulation. It has to be genuine. MI collaboration really has to be genuine. So you have to resist the expert role. Acceptance. People are just as wonderful as sunsets if you let them be. When I look at a sunset, I don't find myself saying, soften the orange a bit on the right-hand corner. I don't try to control a sunset. I watch with awe as it unfolds. Carl Rogers. I have to say, when I read this quote, it's a perfect quote, but Carl Rogers really didn't understand Instagram. Instagram? Just the way in which we doctor up photos so what are we talking about? Acceptance. Acceptance really holds 4 pieces: absolute worth, accurate empathy, autonomy, support, and affirmation. It's this belief that someone has the person sitting. So for me, in the work that I do, that the mother who was involved in prostitution and neglected the children and has referred to me as Dr. So-and-so in so many colorful ways is a person of worth. They're worthy. Even though I'm having strong reactions to what's being said. It's the opposite of judgment. I accept her. Like this is, I don't know the story of what brought her here, of how she got here. I accept that this is a human being worthy. And I'm going to use accurate empathy. Really trying to draw out and understand the inner experience of someone. The opposite of accurate empathy is an imposition of one's own perspective. Well, you know, you're not going to get your kids back if you keep this up. That's not accurate empathy. That's me imposing my perspective. Here's Brene Brown describing empathy. Oops.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you climb down. I know what it's like down here. And you're not alone. Sympathy is, ooh, it's bad, huh? No. You want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. At least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
So Brene Brown referenced Teresa Wiseman's work, and I just wanted to slow us down to notice that to be able to see the world as others see it, to be non-judgmental, to understand another person's feelings. We have to be in touch with our own feelings in order to understand someone else's, and for to communicate your understanding of that person's feelings back to them. So that's accurate empathy. Autonomy, support. Remember at the beginning we talked about what are the threats or ripe conditions for people seeking change. They have to perceive in the environment that they have autonomy, but also from within. And so that's what that autonomy support is it's honoring and respecting each person's autonomy, their irrevocable right and capacity of self-direction. They have the freedom of choice. This is important because at times one of the tools we're going to talk about is asking for permission. Hey, could I give a few thoughts about how to deal with this situation with your child you've lost in the custody? No? Okay. Like, am I willing to ask that permission and really follow through with that? Do I really implement autonomy? Even when it's scary. So autonomy support is acceptance. And then you're accepting too that you can't control other people, by the way. Even as a therapist, I can't control other people. I can only control the environment and the reactions that I have in that moment. And then finally, affirmation. To seek and acknowledge the person's strengths and efforts. It's the opposite of to search of what's wrong with people and having identified what is wrong, to tell them how to fix it. I heard there's a title of a book called Be Gardeners, Not Carpenters. Finding ways to resist fixing and affirming them. You know, you've lost your kids, but you showed up to this meeting today, and that tells me how much you care about getting your kids back. You're here. How did you do that? No car. So finding something genuine and accepting that that's where they're at and finding those strengths and affirmations. I heard this prayer cited actually on a podcast by Krista Tippett's on Being. It's called the Celtic Prayer of Approach, and it felt very MI-like. And I will just tell you all, I've actually used this prayer as a ritual when I know I'm going to go in and old muscle's going to be pulled. Like, I know it. I just know that I'm worn out. Or I'm going to want to feel really important and give really big advice. Get over yourself, John. But this is a nice ritual. I honor your gods. I drink at your well. I bring an undefended heart to our meeting place. I have no cherished outcomes. I will not negotiate by withholding, and I'm not subject to disappointments. There's so much there about arresting, isn't it? Arresting parts of us so that we can tune in to others. So that's acceptance. So collaboration, acceptance, evocation. As drawing water from a well, there is a deep well of wisdom and experience within the person from which the counselor can draw. Much of what is needed is already there, and it's a matter of drawing it out, calling it forward. That's what evoking is. It's calling forward the desires, the ideas, the changes of the other person. if the opposite of that is us doing the dump truck, it's kind of like what the Jamie Oliver did. I'm here, I've got a solution, can I dump it into your city? This is, can I draw out, what are you, here's what evoking would look like if you came to the DJ station. What are your concerns in the city? What have been your strengths? What have you all tried? Where does it hurt you all the most in the community? Evoking, calling forward the concerns. What do you desire for this town? What do you think are the next steps? It's this invitation in the questions that pull forward desire. That's what evocation is about. So this is the assumption in the relationships. You have what you need, and together we can fix it together. We're drawing out the goals of the client. They have the motivation and resources from within. People who are ambivalent probably already have both arguments inside them. We just need to kind of stand behind the chair and name them. I thought this was a really nice, I was listening to another podcast. This is Itzhak Perlman, the famous violinist, musician. And it just struck me, watch what he does here in this interview. So you're going to hear one of his students almost frustrated about the way he would coach her.
But Perlman didn't just teach Maya how to play the violin, he taught her something much more important, how to teach herself to play the violin.
I remember lots of lessons where instead of telling me, Maya, okay, clearly you're unsatisfied with that phrase. Here's what you should do to make it better. He would instead say, Maya, clearly you're unsatisfied with that phrase. What do you think you should do in order to make that phrase better? Let's talk about it. Let me hear what your aspirations are for the arc of this musical phrase. What tools do you have at your disposal, either with your bow arm or your vibrato or your tone, in order to make it beautiful? And it's really frustrating. I mean, in the moment you're thinking, okay, man, like you're the expert here, you know?
Just tell me what to do.
Just tell me what to do and make this easier for both of us.
So the more you learn to think for yourself and to try and solve problems on your own, the better it is for you for the future.
What's amazing about what Perlman does there is his restraint creates an opportunity for her strength. His restraint. He is the expert, but he restrained it. And he called forward, what do you think? And that's the difference between someone who's good and someone who's a master, is knowing that when you're restrained, sometimes your restraint is somebody else's opportunity. A great evoking question I heard was, Krista Tippett interview, actually from Atlanta here, Ruby Sales, the civil rights theologian and activist. And she was talking about trauma, but she was also talking about political discourse, the way we talk about hard issues with one another when there's division. And she had one of the best evoking questions. It just floored me. She said, you know, if we only had, if we could just get together and ask across the differences this question, where does it hurt? She believed that evoking that conversation would draw healthier, better, more empathic conversations if we really tried to draw out and understand someone else's experience about where it hurts. I think as therapists we know the value in that. It's hard for our culture to understand that. Compassion. To be compassionate is to actively support the other's welfare, to give priority to the other's needs. It's Rolnick and Miller believe that compassion is actually, it's keeping your heart in the right place. And in fact, it's the one part of the spirit that protects all the other three. You can have, when you go to a car salesman, they can go, nothing against car salesmen, but when you go to the lot, they are more than willing to collaborate with you. They are more than willing to accept your budget. They're more than willing to evoke what is it you want in a car. But the thing that compassion does is as opposed to these pieces for the car salesman. They're looking for their self-interest in the sale. But compassion protects us. I was listening to a researcher talk about compassion. Really appreciated this because I don't know about you all, but I've struggled with, like, it feels real, the concept of compassion feels really kind of vague, but important. And one of the things that in breaking these down is the first thing in compassion is we notice the other's suffering. At a very, like, biological, emotional, cognitive, all three of them, we engage, we notice someone's suffering. We empathically feel it. So there's that's first step is detecting it, feeling it, and then the final step is acting to ease the suffering. And actually this researcher had said that something, used a story that I thought was really helpful, that compassion is something that we need to practice. You have to practice compassion. It's not something that you just can do. Here's an example. You can see someone out in the water and you can tell they're starting to drown. You notice the suffering. You feel it. But you haven't been training to swim. And so when you jump in to relieve that suffering, you've only added to the suffering because you haven't been practicing to relieve it. So compassion is not something we just do. We have to practice it. And let me just say, as therapists, a great place to practice it is within ourselves. Offering self-compassion. Again, in motivational interviewing, if you don't really embody these, the other stuff doesn't work. In motivational interviewing, they structure their sessions in this way: engaging, focusing, evoking, and planning. So if you went into any, I'll just say, in all of my meetings, for those of you that have been in my classes, I pretty much try to run all my classes in this structure as well. I try to engage with a routine and ritual at the beginning. We will focus on what we want to accomplish in that next period. And then we'll evoke. And some of evoking is like this, a lecture, but then hearing other people's reactions. And then planning, how will this change you? What is your plan? How are you moving forward? I use the same structure in therapy. I have an engagement ritual at the beginning. We do a joint focusing period at the beginning with goals. Evoking is about, again, calling forth the child or youth or parents, motivations for change, and then a plan. I always ask at the end of every session, even my younger kids, hey, what's your takeaway? I teach them what their takeaways are. I want them to learn how to open things up and how to close down on something. I think it was Chesterton that said, an open mind is a good thing, but you have to close down on something. I think our kids in therapy, or even our patients in therapy, it's great to open it up, but you have to close down on something. So kind of consolidating the learning can be important. Now, within this process, you have what I like to say is, in the interaction, what you want to do is get your oars in the water. And by the way, this is active listening 101, getting your oars in the water, but they're the first things you ditch when the interactions get really difficult. At least I do. What are these? The oars are open-ended questions, affirmations, reflections, summaries. So open-ended questions, when we do that, we're giving control of the conversation to the client, inviting conversation, understanding their perspective. Good examples of open-ended versus closed-ended. What brings you here today? How has this affected your day-to-day life? How do you hope things will be different? Closed-ended might be, do you think you can do this? Have you talked to your case manager? Are you going to do that plan or not? Are you worried about termination of rights? Again, a lot of these examples are for child welfare because we're dealing quite a bit with our parents in that respect. Affirmations, again, focusing on the positive. There's a genuine appreciation of the strengths. Affirmations can reduce threat. Let me just say something about affirmations. Affirmations are different than praise. And think about this when you're going through this, because, so first of all, praise comes from a place, think of the word appraising. I'm viewing, I'm praising from a position. I think what you're doing is good. That's praise. As your dad from power, I believe that behavior was good. That's praise. Affirmation is about coming at a more equal level and notice. It's almost like it's not about power or it's almost kind of like noticing. Like, wow, you handled that meeting so well. How did you do it? That was a hard session. What did you were able to put words to that. How did you do that? It's this wonder. It's an affirmation in wonder. It's kind of like you're in wonder of what their strengths are. That's more collaborative than from a hierarchy level. When Rolnick and Miller looked at actually effective therapists, good therapists really use affirmations well in their sessions. Do them genuinely. In working with adolescents, I can tell you I've been called out many a times when I offered affirmations just to move things along. I don't know if anybody else has done that, but I've done that. What about reflections? If the Oars was a music group, Reflections is the lead singer. 70% of what you do is about reflecting. Reflecting. It allows people to hear your thoughts and feel. There's something about hearing it back. It's organizing. It shows that you understand them, builds trust. So reflections. And then within reflections, if you go further with this, there's this simple reflection like, hey, this has really been, in fact, you know, like even in this exchange, even when we were talking here, it was said like, I want to go back. This is who I really am as a therapist. And if I say, wow, this is really who you are, that's a simple reflection. You know, maybe a more complex reflection might be, you know, this is raising hope because you feel like you've lost a sense of who you are in this whole thing. It's going just a little bit lower into the desire, into the issue. It's not the surface above what we see. It's going a little bit lower into that. Summarizing, if you are reflecting well in sessions, reflections are like a bouquet of reflections handed back to the person. Here's what I hear you saying. You feel pretty helpless right now. You don't know if you can afford coming to therapy. You are wondering what's happening with your kids because they've been taken away from you. And you really are angry that you're required to come here today. That's what I'm hearing. It's a collection of things. Let me just say, summaries are one of the best interventions when you feel like you have a patient who's going all over the place and feels very disorganized and dysregulated. Just to kind of bring them down, like, hey, could I, and I'll ask them this, I'll ask their permission, hey, could I just collect what you just shared and share it back to you just so that I'm on the right track. And there's something regulating about that. There's something calming when you have a collection of these. By the way, it also offers you the ability to pivot. After you do that, you can say, hey, could I ask, you had said one of the things you wanted to talk about was how you were going to cope with going to court. I know that was one of the things you wanted to talk about. Could we shift to that? So it allows you to shift, collect, maybe link different things. So those are ORs, very fundamental. One of the other pieces in that's really helpful in motivational interviewing is developing discrepancy. This is really when there's a mismatch between where someone is doing and where they want to be. It's really actually leveraging desire. Hey, you have shared with me that one of your values, one of the things that's so important, you can't stand when people lie. Being truthful is so important. And one of the things that you've been talking about has been you've had to cover up so many of these things, so much of the substance abuse. What's that been like for you? So to really using values and discrepancy between what they really in their heart believe and what they're doing, and to really use that as a way to have a conversation. That's one of the nice things about motivational interviewing is it's really about tapping into others' desires and then wondering how do you be consistent with those desires in a way that's healthy rather than a mismatch. Now, some people think advice giving, you don't give advice in motivation. It's your kind of like, remember in the clip with Rolick and Miller, you're just following people around. That's actually not true. You can offer you have something to offer in this collaborative relationship. And so what I would say is be curious, evoke, reflect, and then ask for permission. After you've exhausted, really letting them do that work and asking, could I offer a few thoughts about what you can do? Would that be okay? I'm going to ask for permission. So ask for permission. But if they say no, don't answer it. Follow through with their autonomy. That will be a hard thing, by the way, when you have to follow through with that. But I would say respect it. And then the other thing is offer options. So we say evoke, and what we want to do is really kind of evoke, and then we want to provide with permission some ideas. Hey, did you know that there's a couple things that you can do to treat your traumatic stress? There are treatments that actually can help bring down those nightmares. And you said you flinch when people walk behind you. There's actually some specific treatments that we can do with that. And I'd be glad to link you with someone who does that kind of work. Or we can do that kind of work. Or what? The other thing that you can do is there's a group of other women who have been through domestic violence. That's they've had some of those experiences as well. So you lay out an option of things, and then here's the finishing. What are your thoughts about what you'd like to do? Again, leveraging autonomy at every step of the way. And that's what we mean about kind of providing spaces for informing and advising. It's kind of a misunderstanding about motivational interviewing. There is a space for it. And you should do it strategically. This is from an interview by a coach. I always pronounce his name wrong, so I'm not going to get it right, but it's on the citation there. He did a podcast with Brene Brown on advice-giving monsters. And he said, you might be, when you're giving advice, when you're working basically out of your old muscle and the writing reflex, you might be solving the wrong problem. Your advice isn't as good as you think. And what is the impact that it says on the other person when they feel like you need to give them advice? Here's the quote: when you give somebody advice, you are one-upping yourself against the other person. Again, unsolicited advice. Strategic advice when you're partnering together is very different. So we want to make sure that we're engaging using those oars and through that advice giving, focusing. This is really kind of laying out agenda. I'm going to move through this pretty quickly because we're getting close to dinner here. But this is just an example of an agenda mapping grid that I use. So when I get with kids and families, we'll just map down, hey, I've got some things and you've got some things. Let's put them down in these bubbles. And I'll actually, in a virtual world, I'll put this up on a screen share and I'll use annotation from Zoom and we'll fill in these bubbles. And then my question will be, someone may say, we need to talk about what happened at school yesterday. Okay, let's put that in one of the bubbles. Parents might say, we need to talk about grades. That might be another bubble. I might raise my hand and say, hey, I've got one. You all had asked me to talk with the school. Could I report out about how that meeting went? And then I'm going to ask, where do we want to start? Offering the autonomy back to the family or back to the parent, letting them pick that. So this is just a nice structured way of collaboratively mapping out agendas. Within the evoking process, again, I mentioned this at the beginning, there's 2 times of talk. There's change talk, arguments for change, and then sometimes your conversations will be sustained talk. And this is where it's kind of against change. So when you hear arguments against change, the evoking process is intended to help resolve ambivalence in the direction of change. So again, the solution to sustained talk is to draw out and kind of stand behind those 2 chairs and label both of those experiences. There's also what we call discord. Sometimes people are struggling with their own internal talk, whether they want to change or they want to stay the same, status quo. Discord is more like there's a rupture in your relationship. So as you see here, sustained talk is about the targeted behavior of change. Discord is about your relationship with the client. And you might see discord in a couple different ways. You find yourself in the relationship, there's some defending. People are getting defensive in the exchange. Maybe you start interrupting one another, squaring off in the conversation. Kind of very emotional disagreement with one another, might be signs of smoke. And what's one of the things that you can do? This has been, again, for those of you working in residential or people with very resistant individuals, you want to roll with the resistance. Okay? What does that mean? Well, say someone was coming at me with 2 fists like this. Actually, could I have you come up? Come at me. If you're coming at me, I want you to come like that, and I meet it with resistance, okay? Right, if you could step back. If you're coming at me, I'm rolling with the resistance by doing this. That's what it looks like, thank you. Rolling with the resistance is not about matching it with resistance, it's about connecting with the person and kind of rolling and moving with that energy. With adolescents, this is incredibly valuable because they want you to meet their resistance with resistance. But there's something so disarming when you're just able to go, okay, you want to smoke weed and join the NBA? Tell me more. Like, I'm rolling with the resistance. I'm the worst therapist and I don't have any hair. Let's talk more about it. Now, I'm joking there. You have to be careful when you roll. You don't want to be sarcastic and inflame the situation. But again, what do we want to do with roll with resistance? Avoiding the direct head-on argument. Show that you heard what the other person has said. Actually, this is a really important one that I was trying to train flight attendants, restaurant people, anyone in the consumer service industry. You really want, I hear what you're saying, the product didn't come in the time that you wanted it to. This isn't what you ordered. Thank you for giving the feedback. And so rolling with the resistance. Things to keep in mind, reflections, apologizing, affirming. These are all really good tools when you want to roll with the resistance.
Especially with adolescents.
Especially with adolescents.
The apologizing.
When it's a genuine apology and you're able to show that you're bigger, wiser, and strong, to be able to model an apology goes a long way. One of the tools that I talk about is let go of the rope. When you're in tug of war and you let go of the rope of power and control, what happens to the other person? They fall. And your hands are open and available to something else. See, I've actually said my goal isn't to win. I don't want to win. I want to work with you. So let go of the rope. I'm going to be respectful of the time for your all's time. We are at time, so we're going to stop there. We'll come back to it after dinner.
Dr. Ebert for your really one of two presentations, because it's really like two separate presentations. So we're going to go and break for dinner, and you guys will just go through that back door across the hall. And just another thing real quick, I know most of you guys saw the merchandise coming in, but we have some good items if you'd like to do that during the dinner hour as well, and we'll get back right around 7:30. I'll give you guys like a 5-minute warning before we get started. All right? I'm not like doing one table at a time. Just go ahead. And I have to look getting your plate right now.
Yes, please.
Not too much. This next one I won't. Yeah. No, I'm very likely to stay up here the whole time. Okay. Yep. It's also a ripe time to connect with alumni. In the spirit of some of the things that I had talked about in terms of the structure, I was hopeful that we could we're almost at the end of this first part. It's going to extend a little bit. I've got a couple more slides, and then we'll move into the next section. But I wondered if we couldn't start with just a little bit of what are your takeaways from that first point? What concepts? My hope is that some of it affirmed you in your work, or maybe it shifted for you. But what's a takeaway from that first part for you? We can just kind of say out just a couple shout outs. You don't have to feel like you have to elaborate too much, even if it's just a concept that you reconnected with. Yeah?
You end sessions by saying, what's the shout out?
Say that again?
You end sessions by saying, what's the shout out?
Yeah. Thank you.
Patience.
Patience. How about others? Validation. One of the biggest, just to build off that, one of the biggest things in helping parents is validation doesn't equal endorsement. And helping parents validate their kids in what they're sharing doesn't necessarily mean that they agree with them, but just to validate what they're saying. Validation is such a powerful thing. Yeah. Other takeaways?
I'd say for me, it's been pretty affirming. I think I use motivational interviewing a lot more than I realized. So going back over it again reminds me, oh yeah, this is where that comes from, that thing that you do.
And just to affirm that, that's why I'm talking about it today, because it's almost like after a season of work, this has kind of put labels and categories to what, just in my experience, has been helpful. So I'm with you. Any others? Okay. So one of the other tools that might be helpful as well to stay out of kind of the writing reflex, or you find yourself doing advice giving, this can be really helpful. You can find bigger, and if you want a bigger representation of this, like a full slide, I'd just connect with me and I'd be glad to send you this slide. But I use it quite a bit. I've used it a lot in virtual sessions, and it's just a decisional balance. It allows you to to really stay in that evoking space. And suppose you have someone who's, I'll give you an example, like an adolescent who is dealing with substance abuse, or they want to continue to skip school. So let's use skipping school. So what is the benefit of keeping that behavior for you? Could you, let's really understand what's the benefit of you continuing to skip school. Why continuing to skip school might be problematic. I know that you're hitting those days, probation showing up more, you're kind of letting them kind of talk more about why that might be problematic. So if you made a change, what would improve your situation, just from your opinion? And if you made a change, what would make your situation work? So if you made a change and actually started to come to school more, how would it make it worse for you? And what this tool allows you to do is just really walk kind of 360 without closing down on something. And oftentimes, just taking notes out in the margin can be really helpful. Now, in motivational interviewing, we talk about this acronym, darn cats. And it's kind of like getting to change talk can feel a lot like you're moving uphill, and then once you get up to the hill with that boulder of change, let it go. Roll down the backside of it with cats. So the darn is desire, trying to have conversations about desire, ability. Wow, you just said that you're tired of dealing with this probation, and you're feeling like it's time for a change. Do you think you can do it? How would you do it? So talking about ability, what are your reasons for doing it? So something shifted for you. Can you tell me a little about why? And then what do they need? What are the supports, resources? So that's the type of conversations around preparing them for change. And then in motivational interviewing, when they make that commitment for change, it's almost like getting out of the way. Get out of the way, they're moving now. And so commitment is about naming and labeling that commitment, that new desire for change with them, reflecting it back to them, and activating them, helping them take steps, using SMART goals, being very specific, and then just kind of labeling that into a planning process. This is James Clear, wrote a book called Atomic Habits, and this is one of my favorite. He was speaking at a conference, and I thought this really captured nicely. Once someone has made a commitment, naming their commitment, like being very specific about what they want to do. And here's what James Clear said.
One of my favorite studies is about exercise. And they had 3 cohorts in this study. So the first cohort, they said, I just want you to track how often you work out over the next few weeks, right? So that's the standard cohort, the control group. Second group is that we want you to track how often you exercise. We're also going to give you a motivational speech presentation talking about the benefits of heart health, why habits are good for you. So this is the motivated group, right? The third group They got the same presentation, so they're equally motivated, and then they did one thing differently. And that one thing is they filled out this sentence. They said, during the next week, I will partake in at least 20 minutes of vigorous exercise on this day, at this time, in this place, right? They specifically stated their intention to implement the behavior, so implementation intention. Here's what happened. First group, 1 out of 3 of them worked out. Second group, motivation did nothing. As soon as they left the researcher's facility the next day, they weren't motivated. It's like reading a book or watching YouTube or listening to a motivational speaker, and then you forget all about it 20 minutes later. But the third group, the group that had a specific plan for how they were going to implement the behavior, 9 out of 10 of them worked out. So you can increase your odds of success 2 to 3x just by having a specific plan. And this is the insight. Many people think that they lack motivation when what they really lack is clarity. They think that they need to get more motivated, that they need willpower in order to execute on a habit. If I just felt like writing, if I just felt like meditating, if I felt like working out, then I would do it. But in fact, they don't have a plan for it, so they wake up each day thinking, I wonder if I'll feel motivated to write today. I wonder if I'll feel motivated to work out today. But instead, you can take the decision-making out of it by explicitly stating when, where, and how you will implement the habit. It sounds easy to say, let's just start a plan, let's write down exactly what you should do, and then maybe you'll follow through on it. But of course, we all know that there are challenges that arise, it's not quite that easy. So here's a little strategy that I like to use to make sure you can come up with a better plan of action, and it's called a failure pre-mortem. So the way that it works is you think about the habit, the project, the goal, whatever the most important thing is that you want to work on, and I want you to imagine, fast forward 6 months from now, you failed, and then tell the story of why you failed. What happened? What challenges did you encounter? What was it that took you off course? When I do this with businesses, sometimes we call it the kill the company exercise, because everybody just sits around and thinks about ways to kill the company in the next 6 months. And once you have all that stuff laid out on the table in front of you, you can start to make better choices about how to develop a plan. You can start to have if-then plans. So not only do I want to exercise for 20 minutes on Monday at 5 p.m., but also if I do not exercise because I have to take my kid to practice or whatever, then Tuesday morning at 7 a.m. I will go in.
So what I like about, clearly, he's capitalizing on, earlier in the talk, that idea in that SCARF model, certainty, when the future is certain. And so when we're able to name and be very clear about our intention, and be very specific about them, we get better outcomes. So, once people are that their self-determination and motivation is moving forward, really getting explicit about, specific, measurable, attainable, relevant, and time-based goals. Just to close this out, this is Stephen Rolnick at a motivational interviewing conference was asked, what 5 things would you encourage clinicians in the field? And this was his 5 pieces of advice for us. Number 1, unlearn. I think what he means there is unlearn that writing reflex, that old muscle, and develop that new muscle. Number 2, and this is one that's really hard, slow down. Slow down. Number 3, be humble. Humility has a way of working in and through people, so be humble. Believe in them. That's a hard thing to do when you work with some populations that are really resistant, aggressive, not very easy to work with. But to believe, to restore your belief in them, they're absolute worth. And this is a helpful one too. Go with their language about change. So in our reflections or in our language, adopting their world. That's the goal. Those are really helpful. This is probably hard to see on the screen, but maybe better on your paper. But there are age stages. If you make a commitment that you want to just further your own, evidence-based engagement, and again, that's what motivational interviewing. They found that when you place motivational interviewing with an already existing evidence-based treatment, both go up in effectiveness. There's something about having engagement where, we use an evidence-based engagement strategy with maybe a specific treatment. So they found that when people embark on kind of learning this, that they do that in 8 ways, in 8 steps. First, they kind of really claim and commit to adopting that spirit, developing accurate empathy, so that's the oars, getting their oars in the water, practicing those. noticing change talk, strengthening change talk, rolling with the resistance, developing change plans, and then helping them with their commitment to change. And then the final step, kind of developmentally, is integration with other treatment models. Okay. So just maybe to summarize that a bit, my hope is that by reflecting and reviewing motivational interviewing, it maybe helps you think about where is your stance in the change chairs, and maybe in a time when you're going to be pulled more than ever to be a fixer, to remember where's your post, and maybe by restoring that post, it places you in a place where you're not taking on so much of the responsibility of change, that in essence you're giving back the change process to your clients in a much better way. So that's the first thing, and that can be protective that way. I think the other thing is just to remind you, if you're doing these things, keep it up. That's great. During high stress times, sometimes, I know for me, we drop some of the fundamentals, some of the things that are really important. This next talk I want to really transition into, and where they're connected, is thinking about you all, as I've been kind of laying out, are working in some pretty stressful times. And let me make some distinguish some things here. I mean, there's burnout, secondary traumatic stress, and compassion fatigue. So when we talk about burnout is the physical and emotional exhaustion a helper experiences due to low job satisfaction, feelings of powerlessness, and being overwhelmed. Secondary traumatic stress is a secondary exposure to traumatically stressful events resulting from empathic engagement with traumatized clients, as well as exposure to traumatic stories and events characterized by symptoms of intrusion, avoidance, and arousal. It's like in our work, because we stand in the stream of trauma, we take on the symptoms of trauma. And then compassion fatigue, the profound emotional and physical exhaustion that helping professionals can develop over the course of their career as helpers. So just losing that, as we talked about those 3 steps in compassion, starting to numb and lose that sense of wanting to relieve the sufferings of others. It's not all bad. There's also vicarious resilience, so the positive impact on and personal growth through witnessing growth of others. There's vicarious resilience. And compassion satisfaction, the pleasure we derive from being able to do the work well. Seeing clients change for the better and recognizing the impact one has had on that change. Now it's interesting, when you think about other professions that work with danger and risk, where they can get burned. Firefighters, for example, have a station. They can't proceed into the work until they hit the station. It's hardwired into the process. They have a checkpoint in which they say, do I have the appropriate gear to make sure I'm safe? They put on the fire gear, the helmet, gloves, whatever's needed. And in our field, I think we do a really good job, actually. We have quite a few conversations about what do we do to disengage from the work so that we don't experience things like burnout or treat secondary traumatic stress or even kind of acknowledge. These are the things that we're really familiar with, like, are we pulling away and relaxing? Are we sleeping? Which is a big one. Time off, yoga, exercise, gratitude, nutrition, recreational activities. These are the things you do away from the work for recovery. But what's the protective gear that you put on in the work? What is your gear in engagement? And that's what this is really about at the end here, is what can you put on so that you are addressing your own wellness not in leaving the work for respite, but actually leaning into it. What are the things that you can do or be thinking about? This talk is based off of a paper by Miller and Spring, and it's called the Components-Based Model for Reducing Compassion Fatigue. And they really identify 4 major categories that clinicians should consider: experiential engagement, regulating rumination, conscious narrative, and reducing emotional labor. So when you think about working, how many of you work with trauma, are working with trauma? So, okay, so quite a few of you. If you think about each one of these, this is where trauma is going to, in some regards, try to interfere with your wellness. So let's take experiential engagement. Trauma wants to pull for disengagement and avoidance. So for us to be protected, we're going to have gear that keep us engaged, so we don't disengage and avoid. With rumination, trauma wants to stir anxiety, worry, hypervigilance, and we need protective gear that support our regulation, our own emotional regulation. In trauma, there is a reactive narrative or a fragmented narrative. It's not a cohesive narrative. There's an order to it. And so as clinicians, one of the protective things that we need is a cohesive conscious narrative that's protective. And then finally, in reducing emotional labor, trauma pulls for emotional exhaustion and repression, and a protective piece of clothing is you as clinicians coping. Let's start with that first one, experiential engagement. The research shows that actually you're more at risk, you're actually in a better space as a clinician when you're fully engaged in your work. We used to, at least anecdotally, some people think like, well, if you're overly engaged, and we're going to talk about the risks of that, but it's not your engagement that's burning you out. It's that partial engagement. You're divided, you're not fully in. And so one of the things that's protective is, are you able to enter into your work with your gear on, protective gear, fully engaged? And obviously, where that really works well is when you're fully engaged, but then fully recovering too. There's a relationship there. But we need to have protection in our engagement. So some of us are maybe, we run the risk of being on the right side. And by the way, this changes with different clients probably. This is why being reflective about your own work or peer supervision is really important. Sometimes there's an acknowledgement, I am in the change chair and I am overly and emotionally, you're kind of overly involved in the work. Okay? There's the bell-shaped curve, you're past the optimal level of engagement, and now you're diminishing because you're over-engaged. Some of us are avoidant in our work. I mean, we're kind of checked out from it. And so the healthy zone is kind of in that optimal level of kind of engagement where we acknowledge our thoughts and our feelings. We actually notice our reactivity, our own reactivity in the work. That's engaging. That is engagement when you know what's going on in your body, in your mind, and managing that energy. Where are you right now? When you really look at kind of this season, are you over-engaged? Are you kind of checked out in your work? Different clients, different days. So what do we do with this full engagement piece? I mean, the first thing is, going back to that Irish road, we want to be intentional and proactive, not reactive. The first skill is saying, I need to be intentional with what's going on in your mind and your body. Intentionality means you're going to ask this question on a regular basis, what am I going to do with this pain that's going on in this work? That's intentional. What am I going to do? So intentionality. The second thing is conscious acknowledgement. So you're going to consciously be intentional about what this work is doing to you. What am I feeling? What am am I feeling? How am I responding to this client? What is it doing to me? The act of acknowledging and labeling feelings is in itself transformative. So by acknowledging, what we don't acknowledge, we act out. So conscious acknowledging. And then non-reactivity, being able to simply notice what's going on and being allowed, and not shoulding ourselves, shaming ourselves for having responses. Steve recommended, or Steve talked about this concept of the red ball, and I use this concept. This can be a tool that you use both as a psychoeducation, but also I want you just first take it as a concept for you. By the way, this looks like the COVID ball, right? I promise you, 10 years ago I was using the same ball, I think, and it's not. I'm not trying to trigger anybody. So the red ball is meant to really kind of be to take what feels internal, external. You all have probably seen in your work a training that talks about the windows of tolerance, right? Like, we all have a window of tolerance where feelings can be felt, they kind of rise up and down. And I kind of like, the way I describe it is, you've got your prefrontal cortex, we've got our kind of processing, evaluating options, and planning. That's when we're right here, right? We've got our mind in it, and we've got our heart in it. So usually in sessions, you're traveling up and down with your energy around reactions to the client. Even, not just the client. The client could be fine, and you got a text before the session about, something, and you're all over the place, right? So we're managing this red ball. And sometimes this red ball is irritation. Sometimes this red ball is anger. Sometimes this ball is inadequacy. And it rises. And sometimes the ball gets out of your mind. When you feel it, you're like, you're out of your mind. And you want to just chuck it. Or sometimes you feel this feeling of inadequacy and you just want to check out. You don't want to feel it. You don't even want to be connected to that feeling. And we know from emotion regulation that we thought historically that if you got these things out, that would be good. And then we realized that was terrible science. We don't want to get things out, we want to regulate them. And we want to keep our ball right here. And the ball, sometimes when the ball gets too high, I can't see the situation clearly. I can't be attuned to you. I've got to bring this down. I've got to have my own toolkit to bring these things down. By the way, sometimes when we're able to do this, we can get involved with our clients. Their red ball is rising, and we can do some co-regulation. When my ball's here, I can notice my client is starting to escalate, and I can use what we talked about in the first part of this evening. Can use reflect, like, you're really frustrated right now. This is not the way you thought this meeting was going to go. So I can get involved co-regulating with that. But it starts with me first. I have to be committed to my own emotion regulation. So this is really where this tool can be helpful so that you can be fully engaged, consciously engaged. Where's my red ball? Notice it in your feelings. Notice it in your body. Where does it need to go? Does this ball need to come down? Do you need to pick up your energy? Are you checking out? And once you're able to consciously be intentional about acknowledging that, noticing it, bringing it into a rightful place without reactivity, now you're engaged. You've done the work on it, and the client didn't even know it. You've been doing work for them. You're bringing it right in here. So that's what we mean by conscious engagement. You have to practice this, so you have to be intentional. What are your routines and rhythms for noticing this before and after, during and after sessions? Being able to practice and facilitate a calm, regulated state throughout the day. Do you have recovery strategies during the day? Do you have checkpoints where you say, where's my energy? Where does it need to go? So these are important. I'm not going to spend time on this, but supervision is a great place to really explicitly talk about, and I'm talking about peer supervision, if that's where most of your supervision is taking place, being able to reflect on those, even allowing others to support. So peer supervision and support is essential to experiential engagement. So again, just to review the skills there, be intentional, acknowledge the red ball, and with non-reactivity, regulate it so that you can be available and engaged with your client. Regulating rumination. Oh boy. I mean, I don't know about you, but ruminating about what you did, shouldn't have done, stressing about this where you're driving home, not sleeping because you're thinking about this. Rumination has power. Let's hear, what is rumination?
Hi, I'm Dr. Tracy Marks, and I make mental health education videos. Today's video is based on a viewer question from SS Rose. Can you do a video on ruminants? Not sure I spelled that correctly. I've had times where my brain isn't shutting off, even in sleep. I can still hear my thoughts. Can you go into more detail about this? Thanks for the question, SS. The term ruminate means to run a thought over and over in your mind. This is the figurative definition. The literal definition refers to cows regurgitating their food to chew it over and over. Rumination is not a diagnosis all to itself. We see it in depression and anxiety. Rumination causes people to get stuck in their thoughts and even feel stuck in the negativity of their condition. Typical negative depressive ruminations may be things like, why do I always get the short end of the stick? Or why can't I be happy like everyone else? Anxious ruminations tend to be worrying about things that happened in the past, like analyzing past situations and worrying about what kind of impression that you left or what that person meant by that. At the time that she said what she did, you didn't think much of it. But when you get to the end of the day and start ruminating over the interaction, what the person said takes on a completely different meaning. And it's usually a negative meaning. In both scenarios, it's repetitive, unhelpful, negative thinking. And this is different from deconstructing a past situation so that you can process it and problem solve. In that case, analyzing the past is constructive, and you're not stuck thinking only about the negative aspects of the situation. Why does this happen? It's thought to be related to the overactivation of the default mode network in your brain. I talk about this in a video I did on mindfulness and depression. The gist of it, though, is that the default mode network is the area of the brain that controls stimulus-independent thought. Said another way is that it's the area of your brain that controls what you're thinking when you're not actively focused on something. It's like background thought. Studies have shown that people are more unhappy when they spend a lot of time with their minds wandering. Functional MRI scans looking at brain activity show that the default mode network in your brain is more activated when you're ruminating. What's the difference between this and intrusive thoughts? Intrusive thoughts are thoughts that pop into your mind when you don't want them to. And you're usually trying not to think about them, but they intrude and interrupt what you're thinking about. And this is different from rumination, where you tend to settle into the thoughts and brood over them. You may not like them because they make you feel bad, but you're not working that hard to avoid them. And in some cases, you may even welcome them because some people feel like they need to think about these things.
So, rumination is among the most robust risk factors for depression and anxiety. And then you think about as a clinician how that might have impact. Rumination exacerbates, this is what we know from the science, rumination exacerbates psychopathology. And we're talking about for us right now, when we get caught in rumination. It manifests emotions, particularly as you heard her share, negative emotions, interferes with problem solving, decreases active approach behavior, so we're moving into an avoidance stance. impairs concentration and sensitivity to the context, so we can't think broader. Contributes to multiple mental health disorders such as anxiety, depression, alcohol, substance abuse, binging, self-harm risks. It actually has implications for insomnia, psychosis, interferes with therapy. If you're ruminating, you can't be fully present. And impaired health, impaired sympathetic flexibility. She mentioned the default mode network, and that network, what's implicated is the amygdala, which is responsible for the detection of fear responses, emotional responses. It is connected to processing and consolidating memory with the hippocampus, and it initiates all sorts of hormonal secretions. So it's really on alert to detect threat, and works with our memory system, the hippocampus, to quickly access and gain those memories and bring them to the forefront into our mind when we're not focused. So under stress, it supplies memories not of positive things. Those memories are pumped into our mind about scary experiences, looking for filling gaps. And then it moves into the cingulate cortex, so that's 4 and 5 part of the brain. And this is responsible really for connecting that sensory and stimulus and memory then into the prefrontal cortex, which is in this 4th part of the brain. And we know that in the prefrontal cortex, this is responsible for all sorts of things, such as empathy, insight, response flexibility, emotion regulation, morality. It's essentially where we do a lot of our problem solving and executive functioning. And so what happens is this gets pumped into that part of our brain, and it just this persistent anxious and distressing thoughts, and we go from kind of feeling like we've been engaging in something, and this default mode network starts going, and so we just are caught in this ruminative cycle. And I know I've struggled with this. You're thinking about decisions. You're thinking about an interaction with the patient. You're thinking about how a meeting went. How do you get out of that? How do you disrupt that? And you'll notice a similar cadence in almost every one of these is it really starts first with this kind of acknowledgement. Consciously identifying and intending to this rumination, naming it. That's going to be the first step to disrupting it. John, you're stuck in it. Because now I've already started the cycle of what was on a passive cycle. Now I'm starting to focus. And that's the second part, focused engagement. So by focusing directly on the process of rumination, we are directing cognition versus, again, it being in a passive into the present. And so one way to do that is in a task-positive approach. So this can be, for example, you might do something. You might say, you know what? I'm going to go for a walk. I'm going to think about. I'm going to read I'm going to look at my children's pictures. I'm going to grab this hand lotion that has essential oils in it, and I'm going to rub them. I'm going to specifically do a focused engagement on a task, and that disrupts the autopilot in the system. So focused engagement. What do you do? What is your disruptor focused engagement? I mean, sometimes this is where, as clinicians, sometimes hobbies can be really helpful. Photographer's not in the room, but I had asked the photographer, what kind of cameras do you use? One of the things that I like is photography. And so maybe when I'm stuck in a rumination and I'm just feeling like I need to focus my mind on something that's positive, not negative, I'm gonna focus on those things. What's in your toolkit? Do you have a toolkit of positive, focused engagement? So maybe that's one thing to do is to think about what is, in our ARC trainings or interventions, ARC being attachment, regulation, and competence, one of the models that I also train on, is, we teach kids and parents to have a backpack. And in that backpack are items that can bring your energy down, focused down, like the red ball, and they can bring your energy up. What's in your backpack? As leaders, supervisors, what's in your backpack? Do you have things that you can turn to that will calm when you're in a rumination of anxiety to bring yourself down? Or even pick your energy up when you're feeling really negative? We make these kits and these backpacks with our patients all the time, but probably underdevelop our own. Or maybe yours are great, and that's good. So there's this focused engagement, any cognitive or physical activity that takes us into non-self-referential, so we get out of kind of ourselves. Goal-oriented tasks will activate the task-positive network and move us out of our rumination, and we will interrupt the cascade of increasing dysregulation and recurring negative thoughts. So we're accessing a different network in our brain when we're in the positive, the task-positive network. The pleasure if you have kids and you kind of move your mind off of that rumination and laugh at your adolescent kids who are dressed up for Halloween, and you just can't help but chuckle at that picture. You're activating a different network. What does this do too? It helps us stay in the present. This is where mindfulness again is really helpful. Mindfulness means paying attention in a particular way on purpose in the present moment and being non-judgmental. I think one thing that I would say is, what is your way of not beating yourself up? Once you're able to use that task positive strategy to get yourself out of the disruptive kind of rumination, what do you do in that space? Do you start to get really hard on yourself? Do you start to beat up yourself? That can only feed that next rumination cycle, by the way. You're reinforcing it. The final step in this, or actually it's not the final, it's the third step in this, is social engagement, being deliberate. So another thing that have you ever seen somebody who's just, you can tell they're in their head and they're kind of off and they're isolated, and then someone comes over to them like, hey John, what's going on? That social engagement disrupts that kind of rumination cycle. People are staring out of a window going, well, how am I going to solve this problem? What am I going to do? This grant is due, and we're never going to be able. The funding's being cut. How are we going to keep all these people? Caught in that. And that social engagement is another way. If you're stuck in it, so being intentional where you have relationships that can get around you and support you and disrupt those. This is why healthy relationships and family and friends is so important. And be intentional about cultivating those. And then skill 4 in this rumination is, action-oriented, concrete, experiential, and specific. So when we're able to, so the authors call this ACEs, not ACEs as in adverse childhood experiences, but action-oriented, concrete, experiential, and specific. That's just the way to think about that. If you're going to disrupt your rumination, it's got to have those. That's the coping. You've got to have it. It's got to be action. I've got to focus on a positive, task-positive piece. Got to be concrete, experiential, and specific. That's rumination. Acknowledging, focused engagement, social engagement, and then action-oriented, concrete, experiential, and specific. Is rumination, I'm not asking that people share, but is that something that you've needed to disrupt?
Yes.
Yeah. Yes. It's hard because we play that tape over and over about what we've done and what we should have done and what we do. And so this is maybe just a few steps to maybe disrupt that. Our conscious narrative. What are the stories what stories creep in about our own narrative in our work? Conscious narrative describes having both opportunity and ability to coherently describe a difficult or traumatic experience or memory in a manner that promotes assimilation of the narrative and calming of dysregulation. So it's taking what feels fragmented and scary and overwhelming and making that cohesive. A lot of our work, there's You know, we need structure. We need bookends, beginnings, middles, and ends. It's one of the things that trauma ruptures, beginnings, middles, and ends. You know, this is probably the best image of maybe how to contain narratives in our work. In trauma, it feels like this, all over the place. There's no, you notice there's no beginning, there's no middle, they're stacked, they're all over the place. And so we want to develop what's called a conscious director of our narrative. Again, and these are the stories you can see there on the left. What do we bring? What story are we bringing into our work? What is the conscious narrative or director that we're bringing into this work? What is your running narrative during sessions and in the work? And then finally, meaning making. What does it mean? It's interesting, applying the very things that we know that work with trauma. How are we constructing and stewarding our own narratives in the work? And you can think about that in 3 acts. Before you get into the narrative, during the narrative, and after. So that's the antecedent, concurrent, and consolidation. So Act 1, so this is before we go into the work. This is your drive to work, consciously directing your narrative to examine the ideas they currently maintain. Is your narrative, I'm not good enough, I don't know enough, I can't be enough? Or are you offering yourself in that narrative, you are enough? You sit in hard places. Most people would run out of the room with that problem, but you stay. What's your narrative before you go into the work? Have you ever consciously reflected on that? Be a good steward of it. Integrate it. It can have both, by the way. When I teach family therapy at Vanderbilt, one of the things I say is, welcome to family therapy. It's about feeling inadequate pretty much most of the time and then doing some good things from there. That's my narrative. My narrative is, you will feel inadequate, John. You will feel overwhelmed. But just try to do some good things from there. What is your story before you go into the work? And this is where I think having your why is really important. What is my why? Why am I doing this? Because I think when I find that my narrative before I go into the work is a bit dark or a bit judgmental on myself, that my why can help pull that out. There's a scene from Star Wars, Luke Skywalker. If you're not a big Star Wars fan, Luke Skywalker's training to become kind of a hero. And he's training with that guy Yoda behind him. He's kind of this master. He's the master of what Luke Skywalker, the young guy on the left there, wants to be. And Luke Skywalker, he says, going back to that Joseph Campbell cave metaphor, Yoda says, hey, I need you to go into this cave. And Luke Skywalker says to him, should I bring my lightsaber? And lightsaber is just like a sword. And Yoda says to him, whatever you bring in, you'll have to face. And I think that's true of our work too. Whatever you bring in with your narrative, you're going to have to face in your work. It will show up. Your inadequacies, your fears, your doubts. So I think that's a wonderful quote to just think, whatever I bring in, I'll probably have to face. This is a book, if you want to look at kind of your own kind of your own kind of experiences in the work, I really recommend Trauma Stewardship. It's a book called Trauma Stewardship. This is a quote: "Trauma stewardship is not simply an idea. It can be defined as a daily practice through which individuals, organizations, and societies tend to the hardships, pain, or trauma experienced by humans, other living beings, or our planet itself." I'm not going to go through all these. Actually, in another training that I've done for Richmont, I've unpacked this trauma exposure narrative. But it's simply like, what are you bringing in? Are you bringing in your hypervigilance? Or are you bringing in your competence? What is your narrative? These are just some questions. What ideas or thoughts about your role impact your narrative in a negative way in stressful situations? What narrative do you have that helps you stay balanced in stressful situations? How does your narrative about the experiences of the work, including the work that you do and the relationships in your work, that help or harm the way you navigate difficult situations? How does self-judgment in your ideas about yourself and your roles impact your narrative and being critical of yourself? So again, what is my story about me as a clinician before I go in? Then the concurrent narrative is the story that you tell yourselves kind of while you're in it. Here's a good example. So, resilient narrative versus unhealthy. So the resilient narrative is I can be poised to regulate and problem solve. The unhealthy narrative during the work is an unhealthy or an emotional reactivity. A resilient narrative can be, I can manage difficult situations. I can't do this. Healthy narrative is, the challenge of this case promotes my growth and skills. This is a challenging case. It's only going to improve my skills. Versus, this is why I hate this work. Resilient narrative, I can influence the outcome. I can be part of this outcome. An unhealthy narrative, there's nothing I can do. I feel helpless. Is that the narrative that's emerging? Attending to emotional responses versus neglecting. I'm just moving through a couple of these. Intentionality, using intentionality towards learning or getting caught in the unhealthy narrative that this is too difficult. Being realistic about successes, so maybe resiliency is like, you know what, this is hard, it's been slow, but we're moving forward, we keep going, we keep coming back, versus it's kind of all or nothing. I'm either succeeding or failing. That's not a helpful narrative in the Act 2 during the session. So these are just some questions to think about. What was my narrative about myself in the moment when faced with a stressful situation? What do you tell yourself? How well did I balance a belief in my abilities to confront difficult experiences in my work with an acceptance that my skills alone cannot solve all situations? One thing that can be helpful is it's not just about knowing models and things to do. We can hide behind those things sometimes. It's simply being, is you being enough and giving yourself that. And then Act 3, it is in the reflection. So what is your story before? What is your story during? And how do you reflect about it after? It is in the reflection about the complex or difficult situation that the meaning of the event becomes evident, adaptation is activated, and honing coalesces into a coherent whole. So meaning making. This is James Pennebaker, who is from University of Texas, Austin. And he looked at college students who went through some adversity and had them journal. And then they looked at their health outcomes. And analyzed the content and the quality of their journaling, and then their health outcomes later. And what he found was that when people were able to consolidate, and they saw language like, because of this, cause and effects, because of this, I was able to do this. cause and effect. There was this because, cause, and effect part of their journal entries. Or they would have, I've come to understand. There's a cognitive understanding that was a feature in the individuals that were less sick in the research. The people who were healthy had a consolidation, they had insight or realized, or they now know. So you see that consolidation of learning and understanding and insight. There's that reflection. So that's what we're talking about. Do you have spaces to reflect and notice your thoughts, your feelings, and your body? Do you have protected spaces for you just simply to reflect on you, your narrative? This is a quote that I found about trauma. It should say, excuse me, there is a difference between telling the story of trauma and processing through the trauma. One brings more pain, the other relief. What is consolidation of traumatic material? Consolidation occurs when the emotional and physical arousal subsides as the professional moves into articulation of the narrative. Again, that can be through verbal or through written. This requires that the experience be noticed and to put into words. There's this kind of integration of experience. The narrative should develop from frequent opportunities to consider the deeper meaning of the work. That is how the experiences have affected them and their worldview. What conclusions they have made about their role in attending to the trauma, and what personal meaning they make from that vocation. Integration. These are just a few more questions, and I don't know that I need to read through them, but the key piece here is one way of being protective is developing this conscious director of your narrative. What is my story that I tell myself? What am I bringing in? What am I telling myself during? And what does it mean? I read this last year, this book by Edith Eger, who's a psychotherapist and survived the Holocaust. And one of the things that was really interesting about her resiliency was, and she makes the point in the book, when you are essentially brought into the absolute torture of a concentration camp, you only have one choice, the story you will tell to yourself. That's the only power that you have. That was her conclusion. She gave the example in her book about her, because of the cold and the deprivation and just the fatigue that occurred, her younger sister turned to her at once and said, "Do I still look pretty?" And Edith Eger remembered that, the one choice that she had was to create a different narrative for her in that moment. And she said, she gave her something about her inner beauty rather than focusing on the obvious deterioration of the external. She dialed into the internal. That's the only choice that you have, is the story that you're telling yourself. I think that's really powerful. So she wrote a whole book on it, The Choice, and what is your narrative? And that's how she survived it. So what does it mean to be a conscious director? Be a good steward of the story about yourself in the beginning, in the present, and after. Finally, reducing emotional labor. Being a therapist, you're doing a lot of emotional management and labor. And in fact, you're keeping a posture, oftentimes, a professional desired image, so that you can be trustworthy and competent. And so this can take a toll. And so really thinking about how can we give empathy back to ourselves. One of the things that can open us up from this emotional labor, so emotional labor might also look like, people outsource what they can't tolerate. You're holding all sorts of kind of these balls, these red balls. They're on your back. This is why it's exhausting when you drive home, because you've been holding on to these. In some regards, some of the work actually is maybe being curious about, why am I taking this on? I think this is yours. And why is this one on me? So you get curious about what you're taking on with your emotional labor. And then sometimes it's about putting it here, but it's also maybe giving it back to a person because they need to hold this ball, not you. So this can happen in professional relationships, it can happen in your clinical work. But the first step to that is getting curious. Why am I holding the guilt? Why am I holding? You need to do more. Where did that come from? So having a curious stance. Developing some behavioral strategies. So these strategies can include, are you practicing recovery and noticing in your practice? I think that's the biggest thing. Do you have spaces where you're putting into practice reflective spaces? Being able to practice some of these skills. Do you have balanced supervision? I mean, some of you are providing supervision. Are you providing supervision that has both administrative and technical supervision, but also reflective supervision? Spaces where people can notice, I'm holding a lot of emotional labor. I'm feeling a lot of inadequacy. That these aren't things you should just go out and talk to a therapist about, that these are part of the work. We're teaching another generation of clinicians. This is part of the work. To be able to hold these things and engage them is competent. So balancing supervision. Teaming, are you surrounding yourself with people that it's a we care culture, not a self-care culture? That people notice your fatigue and that's not seen as a judgment, but is seen as a support? Do you have that connection? Are you moving? I don't know about you all, but I've moved less during this pandemic than ever. I've seen more colleagues go to the standing desks than ever. Movement. You're in a chair all the time. Your body needs to be disrupted and moved. So being intentional about movement. Boy, this is I gotta confess to y'all, I'm terrible at this one. Strategic vacations. Do you get out ahead of your calendar and strategically place so that you can be fully engaged and then recover? Like a sprint and a recover, a sprint and a recover. If we did an audit of your calendar this next year, would there be strategic vacations for your recovery? Mine wouldn't. I'm just being honest. I struggle with that. I put my head, if this is your challenge too, I put my head down, and then when I look up, I realize I'm burning out. So, are you creating spaces where you're like, nope, not this year, I'm going to be intentional. I'm not going to be reactive with vacations. I'm going to be proactive with strategic vacations. And then finally, you notice in every one of these kind of challenges, it requires focus, acknowledgement, and engagement. But do you have 20 minutes even in your day to do that? One thing in the pandemic is we put thermometers and you had to take your temperature before you went in somewhere. Do you have a place where you take your temperature? Do you have a practice or a checkpoint where you take your temperature? And I'm talking about of all these concepts today. Where is your station with firefighting gear? Where you stop and you're like, my protective gear, my helmet, my gear. Where's your 20 minutes to remind you of these things? So that you can correct narratives. You can address emotional exhaustion or labor. You can craft a narrative for the day when you're feeling discouraged. And is there somebody that you have around you that can hold you accountable? That doesn't shame you? Sometimes we don't share our goals with some of the people that we love because we don't want to fail them or us. So we just don't have any accountability. And then I think from these practices, engaging authentically. So those are the components for reducing compassion fatigue. Putting on your gear. So I wanted to just leave a little bit of time. What I'd like us to do is maybe at your table, let's do this. Kind of in the James Clear, name your commitment. What was something that was raised tonight that you're going to take action on? What is your action step as a result of today? And I want you to maybe just let's take 10 minutes at your table and just share with one another it could be a takeaway, it could be a specific, but a specific towards action. What will that be for you? Take another 2 minutes, another 2 minutes. Together and close out tonight. Hopefully you all were able to come up with some reflective action steps throughout this conversation. I wanted to leave a few minutes just for any questions or any comments anything I can be helpful with as you're kind of consolidating your evening tonight.
Can we get an email copy of the slides? It's always very difficult to read.
It was hard to see. You know what I can do is I can work with Martha and we can get it in a PDF version that you can kind of see it a little bit clearer. That'd be fine. Yeah, thanks for asking. Other questions or comments? Yes.
Can you just talk about what you do? Because I'd like to hear that. Just for a few minutes.
What do I do?
Yeah, like what is the program that, I know that I like to speak to you about.
In terms of my
Like what you got, what System for Excellence do?
Sure.
What do you work with?
Yeah.
How do you put this into practice?
So the state of Tennessee was sued because they weren't adequately meeting the needs of children who are in child welfare. And it's called the John B. lawsuit. And part of the remediation plan for that lawsuit was the development of centers of excellence, where they would connect our child welfare and juvenile justice systems with experts in academic institutions. So I work at Vanderbilt University. I'm in the Department of Psychiatry. And we try to serve as the state's experts in trying to link the needs of our kids. So when you turn on the TV and you see here in Georgia, you see a horrific child abuse case, those types of cases come to our clinic and we assess what does this child need, what is the evidence-based practices for meeting that need. And so not only do we consult around that, but we train across the state of Tennessee so that our provider network has access to those. In addition to that, I see kids and families, and that's what I do. Teach a lot, teach interns and teach in the graduate school and family therapy, but mostly work in trauma. That's where I work quite a bit. Yeah. Everything I shared with you all tonight has been content for you, but it's been a reflective space that I've been in to keep in the work. I've really had to get back to the fundamentals, and I've had to think about some of these concepts as it relates to what can I do in the work. So I, at no level, gave this talk today about for you, it's a bit of a joining with you, because I struggle too. There are days, my narrative, by the way, is why am I doing this? Why am I doing this? I have obviously friends and family that are in different business sectors, and I'm going, I want to work over there. So I've got to work on my narratives at times. I need resurrection too in my narratives. Other questions?
Thanks for adding to our closet.
Thank you. Thanks for sharing that. All right, alumni, enjoy your evening. Thank you.
If you guys could just join me again in thanking Dr. Ebert for this speech. Thank you for just such a applicable and practical and important during these times presentation. So thank you. And thank you guys, alumni, faculty, staff, students, for coming out tonight. It's great to see you guys. Again, I'll be emailing you guys about CEs, so if you have any questions regarding that, let me know. But y'all have a great night, and we hope to see you guys again soon. Thank you.